Congenital heart defects are the most common type of birth defect, occurring in around 40,000 babies every year.
We get to see them in clinic. We do tests intermittently in the hospital, but there's 99% of their life that they're living at home.
Dr. Ashu Tandon is a pediatric cardiologist at Cleveland Clinic Children's. He and his team recently published an article about wearable biosensors in American Heart Association's Circulation Journal.
A lot of times they come in with symptoms, and it would have been great to know what was going on when they had that symptom. Many kinds of these home monitoring technologies are made only for adults. And so part of the other thing that we're working on is trying to look at devices that are specifically made for infants and children and see how well those work.
That means devices that are smaller and lighter and that may stick on skin or fit on a baby's leg. For older children and adolescents, a more discreet wearable may be preferred.
The question is, how do you interpret a lot of these data, right? So if we have a heart rate number every minute for a month, how do we interpret that? And I think that's really where some of the new analytical techniques are going to come into play for us to understand, how do we make that data actionable, right? What do we do if we get all this data? How do we understand when the patient has changed from their normal? So for instance, for the high-risk infants, we want to really understand what's normal for that infant, and then when are they not normal compared to themselves. So since there's so many different forms of congenital heart disease, setting like exact numbers for what the heart rate should be and what the oxygen saturation should be doesn't work very well. It's more important to say, like, when is this patient different from what they were 8 hours ago, let's say. And so what we're going to have to do is apply some new analytical techniques to the data that we're getting to really define what's normal for them and then when are they having trouble. One of the particular things that we're working on at large at Cleveland Clinic Children's is really helping develop some of these new technologies for kids. We have a new Cleveland Clinic Children's Innovation Initiative to really try and focus on working with industry partners better so that we can bring our expertise to help develop and get new technologies to market. And then we were, along with Nationwide Children's and Cincinnati Children's, we were recently part of the newly awarded Midwest Pediatric Device Consortium, which is an FDA-funded grant, and that will allow companies to apply and get financial support, but also clinical support and intellectual property advice, things that we can help understand what problem are these technologies trying to solve and then get them to market.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.